Okay, again, we're back. We're going to go ahead and start injecting Marie. I'm going to do one side of her mouth and just kind of let you compare right to left to see the results. You ready?
Mm-hmm.
There is some lidocaine in the product, and so it's pretty comfortable for most people.
Can you explain what you're feeling, Marie?
I really didn't feel anything at all.
Wow, good.
Yeah.
Like I said, the product is very thin, so it's not going to over plump people, even though I've always tried not to do that anyway. You can already appreciate the fact that the corner of the mouth is more supported than this side.
So you're saying the patients will not leave here with duck lips?
Never. Not by my hand. I just want to make a little subtle difference for people and not make them look like they've had anything done. Just a little subtle difference. How's the pain?
Fine, no problem.
Good. Alright, you ready? Deep breath in. With this new product, there's a lot less swelling involved. Although you may still bruise if you have the potential to have a cold sore. You still want to be taking your Valtrex prior to doing any needle stick in the mouth area, which will give you a prescription for that. But the swelling should be less than normal with this product.
Now, if I was to come receive this treatment, how long would I be out of work?
Probably just the day of. I mean, I always like people to come get this done at the end of their work day, just so they can go home and use eye soften on the same day. Probably go to work the next day. You may have a little bruising to deal with, but you could put makeup on certainly the next day. Typically, it's not a whole lot of downtime other than maybe just a little bruising. We always tell people don't take your aspirin if you can leave that off for a week prior to, or obviously Motrins, anything that thins the blood. Motrins, Excedrins, Goody powders are the worst. Any herbals that thin the blood, such as fish oil, vitamin E, ginkgo biloba, glucosamine, I would stay off all those for a good week to 10 days prior to injection and until the bruising is gone. We do have some homeopathic Arnica montana here for anybody that wants to try to take that afterwards, as well as we sell topical vitamin K to help bruises go away quicker. And we have some cover up too if we need to go there for people. I'm going to get just this bottom lip a little bit.
Now, how long will this last? Is this something I need to come in every month for? Every few months?
Yeah, no, this is going to last Marie a good year. Yeah. So the way it's cross-linked in the lab, it allows it to not break down as easily as, say, a Restylane product would. And we can use it in the fine lines. Purse your lips. So you can see Marie has a couple of fine lines up here. And I'm just going to put a little bit of product in the line itself. And plump that line up for her. Doesn't take much product either. You know, you don't want to overdo up there either, but who wants those fine lines around the lips? That's just very aging to our lip area. So doing lips, I mean, it's all about art. You just don't go in filling them up and plumping them. You need to shape. You want to, you know, erase any fine lines we can. You always want to support the corners. And most people do really well. First again. Yeah. So just a little bit of touch here and there, and Marie's lips really were not bad anyway. She has good volume naturally. I just wanted to line them a little bit cut off the fine lines, give her a little bit so when she puts her lipstick on, she'll just have a nice little cupid's bow here and support the corners. You know, and all that can be done with no more than 1 syringe of the new Volbella.
Okay. Well, awesome. Thank you for tuning in today. We will post Marie's results tomorrow so you can see how it turned out.
Thank you very much.